Hey guys, quick note before the podcast. Hope you guys are having a great week. I just want to let you guys know that if you have any feedback, I'd really appreciate that. You guys get a hold of me on LinkedIn or my email. That's joe@codessa.io. That's I and the O at the end. Just let me know what your feedback is, what questions you want to hear, guests, all that good stuff. I'll keep giving you guys great content and hopefully keep this thing going. All right, have a great day, guys. Now to the podcast. Hey business family, welcome to another episode of Joe Momo Presents. I'm here with a very special guest. I know I say special every week, but this guest is very, very special. They're a U of A alumni. They are a healthcare professional. They have worked in both Calgary and Edmonton hospitals, and they work at the ICU. And also a very small detail, it's my fiance, Emily. Welcome to the podcast.
Thanks for having me.
So, I posted if you guys don't know, I posted a post on social media about my whole debacle a few weeks ago, 5 weeks ago. Just wanted to shed some light on it, maybe give a little bit more details before we jump into the podcast. So essentially, if you guys don't know, I used to play college football at the University of Alberta, the Golden Bears football program. So I thought it'd be fun to, in my older age now, to relive my glory days by playing joining a flag football league. So did that. 2 games in, one of the first couple plays, I caught the ball and turned upfield and ruptured my Achilles, which sucks, but I mean, it's a routine 4 to 6 month recovery. But yeah, that suddenly turned into a nightmare. About a week in, I developed a massive blood clot in my injured Achilles leg, and it made its way up to my lungs. Pulmonary embolism. I just call it PE. Took a shower, just felt really faint. Apparently, I passed out, and luckily Emily was there to watch over me and find me. Did some CPR, I assume. But yeah, fast forward, I guess. Spent some time in the ICU. And yeah, 8 days in the hospital. Just scary stuff. But yeah, luckily we're here right now and things are looking up. Still have to recover my Achilles, but that's essentially what had happened. But yeah, enough about me. Let's turn the lights to my lovely guest over here. So I mean, don't have to talk too much about what's happening in the news with the whole virus, but healthcare workers are pretty superheroes of our society right now, and I'm happy to have one sitting with me right now. But yeah, I'll let her kind of tell her background story, how she became a nurse, and kind of some of the insights of being a nurse in this crazy world we live in right now. I'll pass it on to you, dear.
Okay, well, I did my first degree at the U of A in physiology and developmental biology, initially thinking I wanted to go into the medical field. And then I did hear how strenuous it was, and I just wasn't prepared to put my life on hold for medicine. So looking for something in the healthcare field, but something that I could also have a personal life with, I found nursing, and I applied for the after degree program at the U of A, and I got in, and I did my last clinical preceptorship in the ICU, and I was fortunate enough to get a job right off the bat, and that was a steep learning curve, but I did it, and yeah, it's brought me to Calgary now, working in the ICU here, and I love it.
like I said, healthcare professionals are doing a really awesome job. I just want to shout out all the healthcare professionals right now battling this virus. It's never a fun thing, but I'm sure we're going to get out the other side, a stronger society, stronger people. And yeah.
And a big shout out to grocery store clerks, garbage men, construction workers, everyone who is currently not at home and is essential service right now. You guys are doing a great job out there.
Yeah, absolutely. You guys are keeping us afloat, keeping society afloat right now. I can't preach that enough. Speaking about nurses, what's one common myth about your industry or healthcare profession that you want to debunk or kind of put to bed?
Well, I had someone tell me when I had switched my decision of going from a physician to a nurse. Someone had said, oh, well, why would you want to do that? You're not at the bedside. But actually, it's the complete opposite. The nurse is always at the bedside. We are the ones holding the hands of dying patients. We're the ones that are comforting loved ones. We're the ones that are advocating for you. So that's one myth that I'd like to debunk. We are always there. You will always see us.
Not to shed any bad juju on the media, but you always see the doctors being the superheroes of the day, and you don't really see much attention out to the nurses, but they're really the ones doing a lot of the nitty-gritty. Yeah. You can't downplay that.
I know, and it takes a team in a hospital, and so we have amazing teams. Nurses, respiratory therapists, dietitians, pharmacists, social workers, occupational therapists, physiotherapists. Like, those are people that are often overlooked, but they play such an integral role in healthcare and in patient health.
Absolutely. Just to switch the gears up a little bit, I know we have some U of A alumni listening and potentially some aspiring nurses, but what's one thing you wish you knew before you began your career as a nurse? Besides all the studying.
The most you'll ever learn is in your clinicals and in the hospital. That's when you will learn the most. You can learn how to put an IV in a fake arm, in a dummy, but in putting it into a real person and them moving around, it's completely different. So you'll learn the most. So be ready and be eager when you get into your clinicals and in the hospital.
That actually draws some parallels to business as well. You could read as much business books as you want, which is, good to have that foundational knowledge, but until you actually do the work and actually go to market and promote your services and product, you're not going to really know what's in store for you. So a good analogy I like to say is you can't read about be better at push-ups, you have to actually do push-ups. So that's kind of something I have in the back of my mind. So what's one big failure or challenge that you learned from?
Well, that's a tough one. Failure. I don't ever think of failures, but I think of challenges in my line of work, and there's a lot, but the biggest challenge I think is helping a family member when their loved one is not doing so well, and they're looking at you for answers and to tell them that they're going to be okay, and you don't know. And most of the time, even the physicians don't know. So that can be hard. That can be hard as they look at you with such, they just look at you like you're this beacon of light that you're going to tell them everything's going to be okay, and it might not be. And you always have to tread that really lightly, and that's pretty hard. I love when I come back maybe the next week and the patient is doing well and on their way out of the intensive care unit. That's always, but sometimes that doesn't happen. Yeah.
I guess we kind of, back to my story in the beginning, we kind of had to be on the other side of that. With me being in the ICU, it's always you look to the nurses to be tell you everything's going to be okay. You're going to go home in a few hours and you're just going to be back to 100%. But I mean, sometimes you got to make those tough calls and tough conversations. But I mean, again, they do so much. You do so much in your profession that, like I said, like you guys are the superheroes right now, and don't know what we'd be doing without you guys. But back to your unique skills. I know you have a ton. But what's one unique skill that's helped you been successful in your career, or what's a unique skill that you'd say that nurses possess that make them successful?
Unique skill. Well, everyone's different, right? Just like I'm sure all entrepreneurs are different in the skills they possess. One skill that I think is extremely valuable in nursing is compassion. And not everyone has it. I think it's a skill that is, it's not even a skill, it's almost an attribute that you possess. And yeah, it's extremely important in not in nursing, but in healthcare, in everyday life, to have compassion for others, for yourself, for your team members. It's right now, especially, it's a very precarious world out there right now, and having the compassion for others and what they're going through.
Yeah, there's back to the parallels of business. Just compassion for all the business owners out there right now struggling to pay rent and meet payroll just because there's the lockdowns and the self-isolation, which is good for society in terms of stopping the virus, or at least flattening the curve, which Emily told me about recently. But yeah, it's really tough to see the light right now when you're amongst the trees, but once you take that zoomed out lens, you'll realize that we're gonna move past this, even though there's some adversity right now. But yeah, I mean, I think things will, me just being naturally optimistic, I think things will be okay. We might just have to go through some growing pains when we start up again, but yeah, I think just keep persevering through this, and we'll be okay. So in terms of everybody's locked down right now, we don't really have much to do outside, or with restaurants being closed, movie theaters being closed, but has there been anything that you've read or listened to recently that's inspired you? Books, podcasts, movies, anything?
Well, one of my good friends gave me a book called Positively Pooh. It's a book.
That's a very interesting title.
It's a Winnie the Pooh book. It's just full of quotes, just of Winnie the Pooh being positive. And she gave it to me when you were in the hospital. And as much as it seems childish, it's just simple things. That's something that's always made me smile. It was funny. I was telling one of my coworkers that often before I go to work, it feels like I'm going to a war on this virus. That's what it feels like. I'm going to the front lines of. Yeah, I'm going to the front lines. That's what it really not a war, because that has no parallels, but just feels like I am going out there to the unknown, and I think that's the scariest part. So some things that keep me positive is you.
Planning your wedding?
Yeah, not really. My parents, my sister, just, I try to stay off social media and not listen to media in general as often, because it's hard. It's hard to hear about COVID all the time, and to hear about the deaths and the family members affected, it does weigh on you. It really does. So something I find is to do something for yourself each day, whether that be learning the harmonica or going for a walk, but just do something for you and try to get your mind off of what's happening just for a little bit.
Right. Yeah, and you're totally right. Like, just the news, just the constant doom and gloom, it really weighs on you. That's why I always tell Emily that I pop in with the news maybe 10-15 minutes a day just to get a grasp of what's going on in the world. But outside of that, I'm off there doing my own thing, whether that be podcasting with my fiance, doing my upper body workouts because my foot is still in a cast. But yeah, just taking time for yourself, and also doing some mindful reflection is also something I found that it's been very helpful. I mean, experiencing a near-death experience is something that will really kind of shake up your worldview.
Life-changing.
Yeah, very life-changing. I was always telling Emily that when you experience something like that, it really puts things in perspective. If you saw my post on social media, I was talking about perspective and how you just have to have perspective. There's nothing really, what's the alternative? Just be pessimistic and dreadful all the time. You have to have that joy in your heart to try and be gracious and have gratitude, and resonates in times like these to stay positive and stay mindful of kind of what you're doing and what you're consuming. But that's a really great question.
It's like, it's very hard, mostly everyone is stuck at home, not much to do, right? So you turn on the TV, but there are like apps you can, like Headspace, my friend introduced us to. You can play with family members, like board games on there. It's kind of cool. There are like free workouts you can look at. So yeah, and don't go to the grocery store too often.
So would you advise wearing a mask in the grocery store? Does that even help?
What does the CDC say? No, I mean, the biggest thing is, the 6 feet is huge, to make sure that you keep yourself away 6 feet from someone. Cover your mouth with the inside of your elbow if you cough or sneeze. If you're feeling sick, don't go out, period. If you go to the grocery store, usually they have hand washing stations. That's really important. Wash your hands before, don't touch your face, don't even go close to your face, and wash your hands after, and clean off the surfaces that if you used your Visa, clean it off. If you used your wallet, clean it off. I've seen people in the grocery store with gloves on, but then they're touching their phone with their dirty glove, and what are they going to do when they take off those gloves? Like, they're going to touch that phone, which had the dirty glove on it. So I know, I get that question sometimes. Should I be doing this? And recommending right now is to keep yourself away from people, limit your visits to any store, and wash your hands. Biggest thing. I don't think I've ever seen so much hand hygiene.
I feel like my hand hygiene is exponentially increased.
Yeah.
Washing my hands every 10 minutes.
Yeah.
Next question was, maybe this doesn't really apply to your situation because you've been a nurse for 3 years now?
Yeah, 3 years.
But how has the nursing industry changed from when you first started to now? Has there been any changes, or I know you're still kind of early in your journey.
Well, yeah, I guess with this new government, there are some changes that were going to be implemented with the firing or the letting go of 500 positions. And thank goodness that did not happen before this whole situation. Like, I'm sure they would have called those nurses back, but, you know, this is just kind of an eye-opening for our society, how imperative certain positions are. And if they were to go, or if they were to be abolished, like, we could be in serious trouble if they were. Mm. Like, I couldn't imagine if we didn't have grocery store clerks and managers. Like, we're getting your food. Amazon?
I guess we're going to go back to hunting and gathering and go to the backyard.
Yeah, I guess that was the biggest change in my career, but I know there was a similar one in the 90s with Klein.
Right.
That actually had nurses going from Canada to the States to do nursing there. So if this does happen, I could see that happening. I could. Yeah. Some nurses, especially the newer nurses coming in. Yeah.
Oh, interesting. I guess trying to switch gears again. I feel like
You're
guys
switching gears a lot.
Yeah, I like to switch gears. What can I say? But I actually want to give some context. This is my fiance, like I mentioned. We've been together for 10 years now. Mm-hmm. 10 years coming in October, which is our tentative wedding date. But I know a lot of you guys have plans being kind of moved around in the coming months with this whole situation going on. But we're optimistic that maybe ours will stay with the date.
Yeah, you never know. You know, they often talk about a second wave coming, which happened with the swine flu H1N1, where, you know, the curve flattened, but then it went back up again just because they saw it increase in. Because once people start going back in society, you're maybe closer to people, and someone could still have it, right? So they're thinking, I'm pretty sure they're projecting, there will be a second wave. What that looks like for us, I don't know. I think when July hits, we'll kind of get a good idea of where we're going to go.
I like to end the podcast with the guests telling the audience a quote or story, anything that kind of resonates with you, or maybe would provide some value to the listeners.
kind of cheesy, but something that I have been listening to on my way to work. It's actually some Bob Marley.
Oh, nice.
Don't worry about a thing.
There's a singing voice.
Every little thing. It's gonna be alright. I don't know. When I listen to that, I'm like, you know what? Everything will be alright. There are going to be some trials and tribulations that we run into, but in life, you'll be okay.
Absolutely. Seems like I married myself here. That's what I always say. It's the same mindset.
And the same singing voice.
Yeah, same singing voice as well. Well, I hope that was interesting to you guys. This is the first couples episode. Maybe if I get lots of good feedback, we'll have more in the future. We'll make it a semi-monthly series or something. I haven't told her about that yet, but we'll have conversations after the podcast. But yeah, hopefully you guys stay safe and stay home.
Stay safe and stay home. No, and I want to give a lot of kudos. Joe kept saying that we're the superheroes, us healthcare workers, but truly, like, you guys are too. It makes me so proud to see society really band together, and staying home is a huge thing to do, and it's so helpful not only for other people but for us too that are working in the hospitals. Keeps us safe too.
Absolutely.
So thank you.
Yeah, thanks guys. Well, that's been another episode. I hope you guys enjoyed, and yeah, shoot me an email if you guys have any feedback or have any other questions. All right. Take care, guys.